Hello, beautiful souls, and welcome to this episode of the Holistic Healing with Lorrie podcast. And very excited today to be talking to Dr. Raymond Perrin. And Dr. Perrin and I have actually spoken before at great length in my 2021 MECFS Long COVID Holistic Healing Summit. I can't believe it's been that long, Dr. Perrin.
I know. Wow. That's wow. 4 years ago. My
Yeah.
gosh. Yeah, I
What's
know.
happened since then? We're gonna be
It's
talking about
incredible.
that.
It's 5 years since the pandemic started. Incredible, wasn't it? Wow,
Wow,
it's gone so
so many
quickly.
things have happened. So many
Yeah.
things. So the Dr. Perrin has been researching ME, so myalgic encephalomyelitis and chronic fatigue syndrome since 1989. And now, of course, long COVID. And he's really expanded our knowledge of diagnosis and treatment of these complex neurological diseases. And he also developed brilliant technique called the Perrin Technique, which is actually an osteopathic approach that he did develop in 1989. And he's gonna be able to explain this far better than I can. But it actually aims to manually drain toxins from the cerebrospinal fluid into the lymphatic system. And as we know, the cerebrospinal fluid can be very problematic for people who have these types of illnesses. So I'm going to stop talking. Welcome, Dr. Perrin. Thank you so
Well,
much
thank
for
you
being
very much.
here.
Thank you very much for having me back, Chloe. It's very
Yeah.
nice to see you again. And 4 years on, you're looking very well.
Yes, yes, yes. And now you also have a new book coming out, and that
Uh,
has come
it,
out.
it's come out, yeah.
Yeah. What's it called? Right, Through the Looking
Right,
Glass.
through the looking glass, and it's although it does have every chapter begins with a quote from Through the Looking Glass by Lewis Carroll. It's for those who think that it's a sequel to Lewis Carroll's book. It's not. What it is why we called it that, why I called it that, was because I wrote a paper in 1980 called Into the Looking Glass. And this was written on the day of my anniversary, my wedding anniversary. I always joke with people saying most people don't write papers on the day of their anniversary. And my wife's forgiven me, but I basically wrote the paper Into the Looking Glass, which we called it with my colleagues at the University of Manchester here in the UK. And we predicted that after the pandemic had settled down, there's going to be a mass pandemic of what we called post-COVID syndrome, which now, as you know, is called long COVID. So when it's actually happened, and we predicted that millions were going to be suffering, and now the estimate, it's a guesstimate really, is 65 million people around the world have long COVID now, and I think there's much more than that. I think
I
more likely about 100 million at least, and more are coming out all the time. Um, and we said this was going to happen, and we explained why, and it's happened. And the reasons for the condition have been very close to what we said would happen. So that's why I called the book Through the Looking Glass, that we've actually come through. And it's interesting, if you actually read Through the Looking Glass by Lewis Carroll, you'll see that Alice, when she goes through the looking glass, everything's upside down and back to front. And that's what we face now, a system that's working completely upside down and back to front. And we have to try and get it back working again.
Mhm. Definitely, definitely. So I'd love to talk more about the specifics of how you approach long COVID and MECFS. But I know that you've told me this before, but how in the world did you get into specializing in and researching MECFS and now long
Yeah,
COVID?
yeah. Well, that was in 1989 when I was working, as quite a few osteopaths do, work in sports medicine, and I was treating sports injuries. And one of the team I used to look after were a big cycling team in Manchester, UK. Those cycling enthusiasts in the States will know that the Sky team was centered in Manchester, UK, and they were the top team in the world for many years. And before that was the Valley Banana team. And one of the Valley Banana team members, they used to wear yellow, so that's why they're called the Banana team. Yeah. And they used to come to me for treatments. And one of them came to me who hadn't been cycling for 7 years. He had ME. And I said, well, I can't help that. I can help your back. I'm an osteopath. What can I do for ME? Remember, in those days, they used to call it yuppie flu. They used to think it was young, upward mobile, young professionals getting it, and they just needed to get out. They were just doing too much work in the office. And they used to so we were told it's just a psychosomatic disorder, more in the mind than the body. But the body was affected, but it was a mind thing. So I didn't think I could help his ME, but I could help his spinal problems and his posture. And then I started working on his posture and getting everything working properly using cranial techniques. And sure enough, within a few weeks, his symptoms improved in his back and his posture, but also his ME. And within a few months, he was symptom free. So he was the one that actually told me, you have to look into this. And he gave me a whole lot of stuff that he'd researched over the years. So after 7 years, he was back to full health. And he said, you have to, you found the answers. So I didn't know I helped him, but I didn't know I could help others. But then I started looking and I realized that, and this was in the early 90s when I started reading everything, I started realizing that ME was a system of basically a disease of dysautonomia, what we used to call sympatheticonia, but the autonomic nervous system was going completely haywire. It was dysfunctional. So most of the symptoms that patients were getting with ME were dysfunctions of the autonomics. And it's interesting that in America, Peter Rowe at Johns Hopkins University came out just a couple of years later with the same ideas. So, the truth's out there. It's sort of for other scientists for lots of scientists to discover the same thing. So I knew very early on that we're dealing with a dysautonomic problem. And so I thought, well, we can help this. But then as time went on, by doing manual treatment on the spine and the cranium, I started looking into lymphatics because some patients had definite issues with the lymph. And then I thought, well, what's the connection? And I realized that there was a lymphatic system, drainage system of the brain. And the lymphatic system of the brain was officially 1980s and before that was officially didn't exist. And I thought, well, wait a second, there's lymphatic problems and there's autonomic problems. Is there a connection? And I started my research work, and my PhD was based on this idea that there was a neurolymphatic system, a drainage system of the brain, and that this drainage system was dysfunctional in ME. And in fact, instead of draining out the toxins from the brain, the lymphatic system went the wrong way, was reversed. And this was completely against medical thinking at the time. So what I then did was started my research work to demonstrate why it was a bona fide treatment, that my treatment was actually draining the toxins of the brain, and why there was a lymphatic system in the brain. And it was all down to hormones. The hypothalamus measures hormones in the brain via a biofeedback mechanism. The hypothalamus measures all the hormones. Hormones enter the brain, and the hypothalamus measures them through receptors. And they're huge molecules. So how do hormones enter the brain? And therefore, the blood-brain barrier, which is meant to stop any large molecules entering the brain, is not the best of barriers. And now we know there are 7 areas in the brain of drainage system of the 7 areas, the circumventricular areas, that allow large molecules into the brain. So the blood-brain barrier doesn't stop large molecules entering, and therefore large toxins can enter. Indeed, they do, in the droves, and the lymphatic system drains them away through the cerebrospinal fluid, and this is now known as the glymphatic system. And evidence has come up over the last 35 years since my original theories, now 36 years, that back up everything I've been saying for years. So it's nice that science has finally caught up to my crazy ideas of in the 1980s and 90s. And there is definitely a drainage system of the brain, the glymphatic system. And my techniques work on this glymphatic system by manual techniques, cranial and lymphatic drainage. Okay. Pause.
So after you worked with this particular patient that had ME and that through your osteopathic treatments actually fully recovered.
Yeah.
Right?
Yeah, that was in 1989. So that was my patient zero, as they say, first one. And he encouraged me to do the research into ME. And in those days, as I've said, we called it yuppie flu. It was called that way, derogatory. It was a terrible term. But everybody thought it was in the mind, and they just needed to get out and do things. But this patient obviously had tried. He was a cyclist, and he just couldn't cope. But with the treatment, he was able to get back on his bike, and he's been healthy as far as I know ever since. That's 36 years ago. So, but he encouraged me to do research into this, and I started looking at other patients, and I realized it was a problem of the autonomics. But then the lymphatics got involved later on in my work. During the next couple of years, I saw patients with lymphatic problems that when I treated those lymphatic problems, it helped the ME symptoms as well. So I thought, is there a connection? And we were taught there's no neurological control of the lymphatics. They're just tubes that they move along, a bit like tubes of toothpaste where you squeeze at the toothpaste and it moves up. So we were told that the blood flow and muscles squeeze the lymph, and that's why lymph moves. We were told there's no neurological control of the lymph. We were also told there's no, and medicine for forever taught that the lymphatics, as soon as the lymphatics were discovered, everybody said there was no lymphatic system in the brain. And there was a theory for many years that there was a blood-brain barrier, and in the 1960s, with the advent of electron microscopy, they could see the blood-brain barrier, a barrier of cells with tight junctions stopping any large molecules getting into the brain. And we need the lymphatics for large molecules, macromolecules. So any proteins that need to be drained away, if they can't get into the blood, they go through into the lymphatics. Any large molecules, large toxins will drain off through the lymphatics, get broken down, and eventually go into the bloodstream. And in the brain, we didn't need the lymphatic system because there's this blood-brain barrier stopping any large molecules getting in. So my research in the beginning and my hypothesis was completely against medical thinking. And that was, and it's almost miraculous that I actually got a PhD, a doctorate at the University of Salford in the UK in this field of saying that the ME was a problem of the lymphatic system of the brain, and by treating it manually, working against this backflow, so stimulating the drainage in a proper way by using my techniques on the head, cranial techniques and manual lymphatic drainage, pushing the lymph into the drainage points in the collarbone. By doing this, we're able to reverse this backflow. And they gave me a PhD out of it. Even when I got my PhD, which was 20 years ago now, 2005, when I got my doctorate, it was a doctorate in something that most doctors didn't believe existed, ME, and most of the medical world said the whole idea, the theory is completely wrong because there's no drainage of the brain into lymphatics. And I was saying there was, and it was going wrong. And we developed a treatment to help it. And then move forward 20 years, we now have so much evidence to support the existence of the glymphatic system, as Macon Nedergaard and her team at Rochester called it. In 2012, 7 years after my PhD, it was proven in mice that there was a glymphatic system, a system of drainage from glial cells into the lymph. And in humans, it's only been actually proven to exist absolutely, they've seen in real time the glymphatic system. Do you know when?
When?
This last October.
Oh,
October
cool.
2024, scientists and surgeons, brain surgeons and scientists in Oregon got together and they did 5 operations on brain surgery operations for brain tumor patients. And they got their permission to inject dye into their subarachnoid space and watch what happened. And they watched in real time, 12 hours, 24 hours, 48 hours, what happened to this dye. And they saw it go through the perivascular spaces in these patients and eventually out of the brain through the parenchyma and out. So they saw for the first time that the glymphatic system did exist in humans. So it was proof of concept. So I've only had to wait almost 20 years to show, because there are people saying, oh, it's in mice, it's not in humans. Well, of course it's going to be in humans. Anything in mice are mammals, we're mammals, and basically everything that goes on in the brain in these mice virtually goes on in the brain and spine, and it might look differently, but the same system. We need a drainage system as well as mice.
Absolutely. The brain is very important. We need
Yeah.
to be able to get toxins out of there.
Yeah, yeah, and this is this is how naturally we do it. And just this month, Making Nedergaarden's group, she's based in Denmark and in America, and her group in Copenhagen have just discovered that it's what drives the drainage is the locus ceruleus, which is a little spot in the brainstem that produces what we call it noradrenaline, you call it norepinephrine, and it's norepinephrine that stimulates the glymphatics to open and close. So when there's too much, when the norepinephrine it contracts the blood vessels and then it opens and it contracts, and this causes the drain. This pump mechanism helps stimulate the drainage. And this is just a paper that's just come out this month, January 2025, in America, in an international journal. And Cell, the journal Cell, and it's just come out. And in my thesis of 2025, I have a diagram showing that one day scientists will show it's the hypothalamus locus ceruleus axis that is the main driving force of the neurolymphatic system. So
in 2005, that's what you said.
That's what I said. I drew a diagram, and now it's been shown. Yeah. Yeah.
Wow.
So
you've
it's
got
nice to be
pretty good about that.
Yeah.
Yeah.
And this is why I thought this is what goes back to my work on long COVID. So in my lectures and my workshops I was giving over the years, I always brought in an example of the drainage of the brain going wrong and proof of it in the case of SARS, which was in 2003. Epidemic went from Hong Kong to Toronto. And Professor Harvey Moldovsky in Toronto and his team led research into this, and they did post-mortems on the patients that died. And 20% of people with SARS-1, because COVID-19 was SARS-2, SARS-1, 20% of the victims died. And this is why when COVID came around, all the heads of states and chief medical officers were warning people there's going to be a lot of deaths. Because initially, all the scientists and doctors, we all thought it was going to be 20% like with SARS-1. Luckily, with vaccines and generally PPEs and all the rest of it, that we've managed to stop this figure going way up. And it's now, I think, the overall death rate from SARS-2 from COVID-19 was under 1%, but it could have been 20%. So anyway, Harvey Moldovsky's research, they did post-mortem work on these patients with SARS-1, and they showed the actual spike protein molecule, and the virus had gone through the olfactory pathway, through the blood-brain barrier into the brain, which is exactly the pathway, one of the main pathways of drainage. And just last year, scientists in South Korea, they showed that the main glymphatic drainage in the brain is through this pathway. And 50% of all cerebrospinal fluid drainage occurs in these perivascular spaces in the brain, and especially the cribriform plate, going into the cervical lymph nodes, the lymph vessels. So 50% of the drainage, we were taught there was no drainage into the lymph. We were taught it all goes back to the blood, to the venous sinuses. Cerebrospinal fluid is produced by the blood and goes back to the blood. But we now know completely different. So there's so much we learn, and it's all in my new book. But this is the thing. So I knew that SARS was going to be the same, that the toxins were going to go through this back. If patients have a backflow of this drainage, it's going to hit them. And this is what. So if you get SARS, if you get COVID-19, you don't need to get post-COVID. You don't need to get long COVID. But if your drainage system is compromised beforehand, if there's trauma to the head or the spine, drainage is not just in the head. Cerebrospinal fluid is called cerebrospinal fluid because it's in the spine as well. And the glymphatics is in the spine as well. It's not just in the brain. So the drainage through the perivascular spaces goes down the spinal canal and down the spinal, where the nerves attach to the spinal cords, there's drainage there as well. And this is compromised. So if you have compromised spine due to postural problems or damage or injuries or just doing the wrong things to your spine, and you've had cranial problems from injuries or could be hereditary even, genetic problems, this will compromise this drainage system. And then if those people who with a compromised drainage system get hit by COVID, then instead of the toxins all draining out, they'll go into the brain and they'll stay there. They won't drain away. And if that happens, and it's autonomic control, sympathetics control all lymphatics. Every lymph vessel besides the small capillaries have sympathetic nerve control. So all the collecting vessels have sympathetics attached to them, pumping away. And they should pump one direction, but with the dysautonomia, they're pumping all different directions. And they'll pump back into the brain and into the spine, and toxins will build up. And if you remember with SARS-2, with COVID-19, on television, they were talking about the cytokine storm that was hitting people, the viral loads and cytokine storm. These cytokines are what are left after the virus is hit. Cytokines are the protein molecules, large molecules that are signaling molecules for the antibodies. They say, "Cooey, here's the virus, come and attack us." And then afterwards, those cytokines have to be drained away, because if not, they'll attach to healthy cells. And these cytokines are produced by mast cells. And nowadays you don't discuss COVID-19 without talking about and long COVID and post-COVID, whatever you want to call it, without talking about mast cell activation. And there's mast cell activation syndrome. When we see this again and again, we saw this with ME, and we're seeing this with long COVID. And there's cytokine storms, and they're just not draining away because you need the lymphatics to be healthy to drain away. And I said, this is not happening with ME, and it's not happening with long COVID patients. So there's going to be this build-up. And just again, this month, there's a paper just come out from the Bateman Horn Center and other researchers. That's in Utah, in Salt Lake City. And Susan Vernon's the lead author. And she just produced this paper looking at how long COVID has just basically morphed into ME CFS, and people with long COVID are 15, I think the number's 15 times greater risk of getting ME CFS than the average person. It's basically the same condition. It goes into this. And so we're treating now a lot of people who were diagnosed long COVID maybe 3-4 years ago, who have now got full-blown ME CFS symptoms, and we're treating them for that. So, and we predicted all this in year 2000. So it's all happening. And thankfully, I've got a treatment that actually can help. And it has been helping people for 36 years now.
Yeah, and one of the things that the first time that you and I spoke was so exciting to me is that I think at that point you were in the process of creating resources for people to be able to certainly to go to practitioners who have learned the Perrin technique, but also to do it on themselves.
Yes.
So can you show us maybe just one or two places
Well,
to
it's interesting. Yeah,
start? Is
yeah.
that okay for me to ask?
Yeah, no, no, no. We can go through a few things that patients can do, definitely.
Great.
But the beautiful thing that with technology and we've managed to invest in some very good online resources. So in my website, we have a video that I paid quite a lot of money for a proper film company to come to our clinic. They even had a clapperboard, and they did a film of all the techniques that I teach. So I can open up, and there's no subscription. It's free. It's for everybody. You just go online and you can see the video, and you can. These are self massage and self exercises that we know over the years have helped people, and this is for I want people to be helped, and we've actually used this. We use this resource now, but we had another video we used before. Now this is a more professional video, which was made because we did a study with the National Health Service on self massage and self exercise routines, so patients can do at home. And we wanted to see, does it help these long COVID patients? So the National Health Service sponsored it. They didn't pay for it. They never pay for any of my work, unfortunately, but they oversaw it and they put the stamp there, gave their rubber stamp to it. And we took, it was a feasibility study to see if patients would comply to what we were asking them to do with the self-massage routines that I'll show you in a minute, show you a couple. And it was very successful. We had 79% compliance. So 79% of the patients went through the whole 3 months of doing it, and some of them improved a bit, some of them improved a little more, and some improved tremendously, and some were completely symptom-free just doing themselves. So this was a really good study, a good feasibility study. Better than the control group, who was a waiting group. They waited 3 months and then they started. When they started, they actually improved well, but that wasn't part of the study. The study was to see, is it feasible to have a study, and hopefully we'll have in the future a much larger randomized control study doing this. But
That is
self-massage
very
routine,
cool.
yeah.
And I just wanted to ask you a question real quickly.
Yeah.
Because I'm assuming that for this to work well for someone, because we're talking about glymphatic drainage, we're talking about lymphatic drainage, but in order for all of that to be able to drain actually out of the body, we've got to have the liver and gallbladder working well. We've got
Yeah,
to
yeah,
have the GI tract working well, the corking, and
yeah,
all the
yeah,
drainage pathways
yeah,
open,
yeah.
right?
Yeah, which is why we don't generally tell people to do it all by themselves. It's better to do it together with a practitioner who's trained and who understands the complexities and can give advice on supplements and all sorts of things and diet. We unfortunately weren't given the opportunity to do this in our research. We just wanted to see, because NHS being a free medical system, anything that's free, they love. So they jumped for joy when they said, "Oh, we've got a self-massage routine that might help." We just wanted to see, does it help at all? Does it reduce the symptoms at all? And to tell you the truth, I wasn't sure it was going to, because we usually see patients get worse before they get better because of the
Yep.
toxicity. It's not Herx,
Yep.
it's not a Herxheimer reaction, not the Herx reaction. It's more basically we're dealing with real poisons. And when you start draining them out, their real poisons can cause problems in different parts of the body. And the liver needs to cope, and the GI tract needs to cope, and all the organs need to cope. So it is a problem. So we told people to do it very gently, everything slowly, and if they find it's too much, then back off. So that's the only thing we could tell them to do, because it wasn't a study. We couldn't add extra things to it. But it generally, they were really, most of them were really happy doing it. As you saw, that 79% carried on right through, which is amazing. Usually the dropout rate is like 50% dropout at least, and we had only a dropout of 31% in the whole study. So we had 21%. Sorry, so 79% continued right through. So it's really, really good.
Yeah.
But the thing is that so it's feasible. the feasibility study tick the boxes and hopefully we'll go further. But we want it to do together with treatment and with advice. In clinic, it's a completely different situation. So clinically, we will actually be using techniques together with the patient, doing their self-massage and self-exercise routines. And we're talking about self-exercise, not running on a treadmill or swimming 100 lengths. We're talking about just gentle motion, gentle rotation exercise. So those are the things I can probably show you now. One of the exercises that we always give is dorsal rotation exercise, and I'll just sit back a bit to here, and basically you start by putting your hands over there and just gently rotate just a small amount, not too far. So a very short distance, short angle. The arc of movement should be around 45 to 60 degrees total. So it's about 30 degrees maximum each direction, just gently with your hands to the side of your neck. And that gets the upper thoracic spine moving. And this takes the drain, helps the drainage in this area. Then we hug your shoulders like so. And then
Sorry, with this one, where is the center of movement?
So the movement is going to be in the spine, in the actual spine. So your head and neck, everything moves together, and it's just the top of the spine, just the very top. So not too far. If you go too far, you'll move your lumbar spine. A lot of patients end up doing this, and so you say, you told me to do this and that, and it's just that's the lumbar spine you're moving. We just want the thoracic. So just there, and then we hug your shoulders, and we do the same thing again, just gently. And then folding 5 times each way, and again folding your arms, and that's the lower thoracics. But it's always the thoracic spine, the mid part of the spine, we're trying to get moving, because that is the area that is always a problem with ME, with fibromyalgia patients I've seen over the years, and long COVID patients we're seeing. They've got a spinal problem, and it's usually because of being very, very sporty when they're younger. They've put a lot of strain through that area, and the spine should be curved, but often it's very flattened. And I mentioned Peter Rowe, Johns Hopkins University pediatrician, professor of pediatrics there. He's discovered the same thing, that there's spinal problems in all ME patients. And he's found there's a lot of stiffness in the mid-thoracics, coupled with a lot of hypermobility in the neck and the lumbar spine.
I was going to ask about Ehlers-Danlos.
Yeah, hypermobility. Ehlers-Danlos, as you know, is a big comorbidity in these conditions, and it's been seen again in long COVID, big comorbidity. So hypermobility is a problem. It's collagen damage. Ehlers-Danlos, if there's collagen, if there's genetic collagen dysfunction, it's going to affect the joints and put strain on the joints and cause inflammation. But also, the Ehlers-Danlos affects collagen, and you've got collagenous fibers attached to the capillaries of the lymph, allowing the drainage to occur. And when they get damaged, then it stops the drainage occurring, and it just pushes the lymph in the wrong direction and creates more buildup. And this is why you see in many cases of Ehlers-Danlos, you see stretch marks, striae gravida. And in ME, you see this as well, stretch marks. And stretch marks is collagen damage just below the surface. So it's these fibers. So where do we see the collagen damage? We see a lot of stretch marks in breast tissue, where there's a lot of backflow in the breast. And also that's the first port of call. When there's backflow, it will come down into the breast tissue. And also we see it in the thighs, where there's a long distance between the popliteal lymph nodes and the inguinal lymph nodes, the longest pathway for lymph vessels to go. And when there's a backflow, it's going to affect them. So a lot of these patients with ME and fibromyalgia, a lot of them will have stretch marks early on in life, and they didn't know there's any connection. But it shows that there's a compromised lymphatics many years before. But there's a link between Ehlers-Danlos and hypermobility from the spinal problem as well. If there's very hypermobile cervicals, the thoracic's going to stiffen up even more and cause more problems and more inflammation.
Fascinating, and makes sense. Makes a lot of sense.
Well, that's what most of my patients, when they come to me and they read my work and they say, I feel poisoned. They feel poisoned, and they say, we didn't know why, and then we saw your work and it all makes sense. And it was Thomas Huxley, a famous scientist of old, who said, science is nothing but organized common sense.
I love that. I love that. And, another thing that I really appreciate is that this is a part of a whole, right? And I teach this all the time. We don't want to just address one thing. We're not just addressing the glymphatic system. We're not
Mm.
just addressing the lymphatic system. We're addressing the whole body, the whole
Yeah, yeah,
drainage system,
absolutely.
the spine, everything. So,
Yeah.
uh,
But the thing is, so many people miss out the lymphatics. They treat the blood flow, they'll treat the organs, they'll treat all the viscera, they'll treat the gut. And then you talk about lymphatics and they go, I learnt about them in college once, maybe one
right.
lecture, maybe one
What do we
lecture, maybe.
do?
The
So,
lymphatics have been missed out by so many people who are leading doctors and they talk about lymphatics and they don't know much about it because they've never been taught. And what they have been taught is completely wrong, unfortunately. By eminent doctors of old, as I say, no, I was taught there's no lymphatic system of the brain. I still get this. I just had a discussion of just a couple of years ago with a top neurologist in London. He said, I teach all the doctors in London University, and there's no lymphatic system of the brain. And he was absolutely adamant because he has taught for years there's no lymphatic system of the brain. And
because he was taught that.
he was
So,
taught that and he carries
right.
on. And therefore, what does an osteopath, oh, I might be a neuroscientist, but I'm an osteopath. What do I know about the brain?
Yeah. Well, obviously now it's been proven much more than
Yeah.
good. And well, it just makes sense. I can't imagine that something as
Yeah.
intelligent as the body would not have a way to get rid of toxins in
Well,
every
it was the
single cell of the
fundamentals,
body.
Laurie. It's a fundamental teaching in osteopathy. Andrew Taylor Still, the founder of osteopathy, and William Garner Sutherland, the founder of cranial osteopathy, talked about the waters of the brain draining into the lymphatics. They talked about this system then, 100 years ago and more. And the thing is, why it changed was because then when in the 1960s, when, as I said, when the blood-brain barrier was proven to exist, that whole idea of a lymphatic system of the brain ceased to exist. Obviously, there wasn't a lymphatic system of the brain. It didn't need to be one because large molecules didn't get in. And now we know there are 7 circumventricular areas in the brain, 7 areas and organs in the brain that have a weakened blood-brain barrier or virtually no blood-brain barrier. So large molecules like hormones can come in, large molecules, electrolytes can come in, and the hypothalamus, the main center of autonomic nervous system control and main center of hormonal control. The hypothalamus has 2 areas. The organ vasculosum is one of them. And these areas are so important of drainage. The pineal gland is another one. There's 7 major areas of drainage of the brain, of not drainage of the brain, of openings, of gaps in the blood-brain barrier. And these gaps allow large toxins in, and therefore large toxins have to be drained away. And that's where they've now proven that there's a lymphatic system to do this. And we need this system. And if the system is working in the wrong way, you're going to get all sorts of conditions. ME, long COVID, fibromyalgia, I've been working on. But virtually every neurological condition has probably got an element of this. And Alzheimer's especially, where there's been a lot of research into the drainage of the brain and Alzheimer's. So I would say Alzheimer's is definitely a problem of the neurolymphatic system, of the glymphatic system as well. I'm not saying we treat Alzheimer's. I have seen some patients and helped them, but there's a lot more research to do before we start making claims for everything. But that's for other researchers to do.
Yes, yeah. Yeah.
I can't do
Well,
everything.
I am very excited to send people to your website,
Yeah,
first of all, for these free videos. And I'm actually
yeah.
probably going to incorporate this into my programs as
Yeah,
well.
absolutely. I mean, it's
Yeah.
basically just very simple massage techniques down, very gentle down the nose, and just gentle pressure techniques. We teach how to stimulate the cranial rhythm using the book And this has been used in Alexander techniques for a long time. Active headrest, lying your head on the book in a semi-supine position. All those are in the video. Simple things, even contrast bathing to reduce inflammation in the spine. We have the video showing exactly how to do it with a warm water bottle and cold compress. So everything's online, free at the Perrin Technique website. It's for everybody. But the thing is, you should, if you have long COVID or you have ME or have fibromyalgia, and I'm training up a lot more practitioners in the States. I'm coming to California. Terrible what's happened in Los Angeles. So it was going to be in Los Angeles. We now moved to down to on the coast south of Los Angeles for this workshop next week. I'm coming over, and then I'm going to Salt Lake City to train up a whole group there. And we've got a few more workshops planned. Last year I was in Alaska training up practitioners. I think one of the highlights of the Alaskan trip was a doctor who came all the way with his wife. He was an MD. He was a doctor specialized in infectious diseases, and he got long COVID. And the only thing that helped his long COVID was Perrin Technique. So after getting better from it, he came with his wife, who's a doctor as well. They came up to Anchorage for training in the Perrin Technique. And he's not an osteopath or manual therapist. He's an MD, doctor of infectious diseases. And he took my training, and he says he wants to use it on his patients. So that was really a real highlight for me. And we help people a lot. I was training a whole group in Minneapolis, where one of my practitioners, Ruby Tam, set up the first free ME clinic in the world. She's a saint. She should be given a sainthood. So Dr. Ruby Tam, she's a DO in America, a doctor of osteopathic medicine. She retired from a general practice, and she now specializes in treating ME, fibromyalgia, long COVID, in her clinic in Minneapolis. It's a free clinic. And she had a patient who came to her, Lorrie. And I'll tell you now, this is an amazing story. Can I tell it? Or have you got time to tell
please.
it?
Yeah.
So this patient, he came to speak to the group. He was at the end of his tether. He had an illness he didn't understand. No doctor understood what was going on. And this was for many years. He had tried everything. He'd run out of money. He couldn't afford any more treatments, or they didn't know what was wrong with him. And then he heard an interview with myself and somebody else, another podcast. It might have been yours, I think. But he heard a podcast talking about my work, and he said, that makes sense. That's what's wrong with me. I've got ME. Nobody's diagnosed it, and I know I need the Perrin Technique. But that was and he looked online and he saw Ruby Tam had set up that clinic that very day, and he told the group it was that day when he saw this. He just looked on the web for what he thought was the last time, because he decided he couldn't cope anymore. He had two daughters who had grown up, and he thought he wanted to see them grow up. But as soon as the one was just going to college, he decided to end it all. So that day he was going to he planned his suicide. And he told the group this. And he saw this interview with me. So you never know who sees this interview with you and I now. And he then sought help. And he announced to the group in Minneapolis, he came to talk to us, and he said, the last few weeks I've worked full time. I was off work. I couldn't do anything. I couldn't struggle to do anything, and is now working full time and has got his life back. So, that's what we do. That's why I do. That's why I go around the world and teach, and that's why I talk to people like you, Lorrie, because you never know. You never know who's listening and how it might change their lives. So hopefully it will help a lot of people.
Absolutely. Dr. Perrin, thank you so much for
My
everything
pleasure.
you do, for everything that you have done, for everything that you're continuing to do. We're going to bring you into Charlotte. We're going to figure out how to do that, to do some training.
Well, I'd love to come.
Y'all, if you're watching this, if you know of anybody who can benefit from this, please share it with them. go out and buy, well, you don't have to go out anywhere now to buy his book.
Yeah,
You know,
it's on Kindle as well. It's actually this is the first Through the Looking Glass book is the book that came out just in November, and it's sold out in the first month. So it's I think you can still get it in Amazon in America, but in Amazon in UK they've sold out. So they've reprinted. So the reprints are being worked on now. So yeah, it's been obviously there's a lot of people out there that need it, and
absolutely.
and
Absolutely.
yeah.
Yeah.
And thank you for all you do as well, Lorrie, in spreading the word of health and helping so many other people as well.
Absolutely. Yes. So thank you all for watching. And, like I said, if you have anybody who can benefit from this, share it with them. Please also subscribe and let me know what else you would like to hear about. And I will see you in our next episode.
Okay.
All right. Oh, that was so much fun.
Okay.
I really do want to get you over here. I know I was
Yeah.
so like gung ho about it, and then I think perimenopause hit and everything just went.
You're too young for that. Honestly.
Oh no, I'm not. I'm 50.
You're joking.
No,
Are you?
I'm 50.
Oh my God. Yeah,
Yeah,
and in the old days, in old money, I'd be in retirement age this year. I'm 65 this year.
What? You don't
Yeah.
know. That's another
It's
reason the internet
it's the Perrin technique.
There you go.
Yeah.
That would
Yeah.
sell it super fast
No,
too.
but you're doing
So
very
I
well.
have something else in 1 minute. I'm so glad that we got to
No,
do this.
so you keep them
Let's
busy.
keep in touch. I
Yeah,
actually
do absolutely. So Charlotte, so which parts of excuse my ignorance, which
Charlotte,
Charlotte's in
North
California?
Carolina is on the East Coast.
It's North Carolina, isn't it?
Yeah,
Yeah, where's
North
it is North
Carolina.
Carolina because I've been to Asheville, so
Oh, I
Charlotte's a
love
bit
that.
further. Yeah,
Yeah,
yeah, Charlotte. Yeah, that's right.
yeah.
Yeah,
So
that's.
let's keep in
I
touch about
think one of my friends is there, Chuck Lapp, isn't he in Charlotte? I'm
Yes,
sure.
yes,
Charles Lapp.
yes.
Chuck.
He's
Oh,
I love
yeah.
Dr. Lap.
Oh,
Oh,
is it lovely? Yeah, I'd love to come. We spent time in Stony Brook in the last international conference.
we
We
can all
spent
get
some
together and
time
hang
together.
out and geek
Oh,
out
that'll be
on ME.
amazing. He's such a lovely man, such a lovely
Yeah.
man, such an amazing man,
Yes,
amazing
yes,
doctor.
yes. Very cool.
Right.
All right. I'm gonna sign
Okay, so
off.
you go off and
Yes,
we'll keep in touch. Take care. God
absolutely.
bless.
All right.
Bye-bye.
Take care.
Bye-bye. Bye.
Bye.